Hi, I'm Barbara Konkle from the University of Washington, and I'm here today with Dr. Lindsay George, a hematologist at the Children's Hospital of Philadelphia and a lead investigator in many clinical trials, including gene therapy, and Jay Konduros, a person with hemophilia who has received gene therapy. And we're here to discuss shared decision making in clinical trials. So I'll start with Dr. George. Why is informed consent important?
So first and foremost, it's important for either an investigational product on a clinical trial or a licensed product that has been approved by a federal regulatory agency for the patient to really be knowledgeable of the risks and benefits of the therapy, as well as what we know and what we don't know. And so I think that's globally important for any informed consent.
So, what specific steps do you take to make sure your patients are well informed in this process?
So I think one of the most important pieces is we try to have this be a multi-step conversation, and so never really have it be a one-time conversation, and also provide some information either ahead of time or in between a couple of those conversations. So we always have to have the consent be meet the patient and try to understand first what they know about gene therapy and what they don't know, and just try to educate them globally about gene therapy and then start to go into some specifics of the therapy and of the particular vector that we're working on towards informed consent.
So, Jay, in your process, what can you share how it went, what you thought worked well, and what you thought might have been missing?
Off the bat, I think I was really lucky on this trial that I don't think anything was missing. I couldn't think of one thing that disturbed me. Right from the first knowledge that I could get on a gene therapy trial, I was given enough information by my doctor in Toronto, and then I set up an initial meeting with him, which was several weeks down the line. So in between, I was able to read up on gene therapy because I wasn't really following it too closely. Then there was some blood tests and that were scheduled. So there's another several weeks in between me arranging a meeting with, actually it was a phone conversation with Dr. George. So in between those times, I was able to find out a lot of information online. So I got a real good sense of the people that I would be dealing with in the organization. So that was actually, in my view, that was my own starting of informed consent, like on the people side of things. So that I was able to meet with Dr. George, where I had questions, and they were all answered very well, and I got a really good feeling again of the stability and solidness of the people I was dealing with, and the state of gene therapy, and then there was an in-person meeting a few weeks before the dosing, if I was to go forward with it, and that was with I don't know, like a 30 or 40 page informed consent document, which I had reviewed, so I was able to read each paragraph and understand what it meant to me. And if I had any questions out of a particular paragraph, I would mark it up. So I came with a marked up informed consent with any questions that I had. Of all the information I had received before the informed consent document, the document itself was pleasantly no surprise. Every page was like, yeah, I know, yeah, I understand that. And there was a few questions that were, unclear, so I was able to ask those and get them answered.
But it sounds like that having a multi-step process that gave you time to get to know the investigators and the process and having the informed consent ahead of time so that you could review it were really key to the process and developing trust in the
Right.
investigators and the trial. You talked about a lot about looking things up, doing your own investigation, and how important was that to you, and how important do you think that is for others who are considering gene therapy?
For me personally, since I have a science background, it was partially a lot of and I was really intrigued by the science behind gene therapy. So reading up on it was a pleasurable experience and didn't frighten me. And I actually learned a lot about areas of science I wasn't familiar with. I did that because that's what makes me feel comfortable about anything, is if I understand it. However, if someone comes about acquiring their trust and understanding in what's going to happen to them and makes them feel comfortable, I think that's key. Because if you're feeling comfortable all the way through the trial, then it's just a pleasurable experience. There's no second guessing. Having said that, I think it's a kind of a duty for sure. That's why the informed consent it's fairly technical and detailed for sure. But I think it's a duty of anyone to, for themselves, make sure they understand it and stop. There's a duty to not listen to anyone else, and just for yourself, do you personally understand this? It's because the onus is on the person, no matter how scientifically adept they are at understanding, needs to do their homework.
Did you find or did you see information that available that would help a person if they didn't have a science background like you have?
I would say I've noticed now, because I did this trial like 6 years ago. So I noticed there's definitely been a difference in the type of information that's available, in a good and a bad way. So in a good way, the whole field is much more advanced and understands, like the scientists know a lot more than they did 6 years ago. So there's a lot more detailed information and where the risks are and where the risks are kind of reduced from what they thought before. Unfortunately, because it's become popular in the press, there's a lot more of the Facebook, weird information that's not accurate and it's misleading. So the only thing I would say now is it might be a bit more difficult for someone to navigate what information is worth understanding, like on any level of technical, even if it's very high level. I've seen a lot of high level statements that are just categorically wrong. So,
Lindsay, given the long informed consent for gene therapy clinical trials and for other clinical trials, what are the key points that you want to make sure that the patient considering the study understands?
First, I always just assess where the patient is at and what work they've done on their own, or what background they're coming from, to understand this, and spend a lot of time educating best I can, so people understand just the nuts and bolts of what the therapy is. And then from there, you can jump off about some of the potential risks and some of the, hopefully the benefits. And so again, I think it's important, it's key to just educate patients about, what our adeno-associated viral vectors are and how they work. And then therefore you can understand some of the risks, and then, obviously therapeutically how they work. The other piece, to pivot a little bit, that differs again from sort of really any therapeutic, is I do think that AAV vectors and many of the gene therapy products in various phases of clinical development are distinct from other development of other therapies, namely because both the goal is really that this would be a multi-decade, potentially lifelong therapy, but that then also means that we can't take this back. And so the potential risks are, theoretically throughout the patient's lifespan, and potentially the efficacy is long-term as well. And the other key point where we're at currently with the state of development of AAV vectors, and from the available information, currently it suggests that you can only receive one lifetime AAV vector. And so making this decision, picking the right vector, and also I think that's an important risk that should be outlined on a clinical trial consent.
After a participant has agreed to be in the study, what's your experience with the expectations of the participant in the clinical trial?
Certainly the expectations are, I think, quite a bit higher than they were even 5 years ago, but that's well-founded, right? I mean, we've had a lot of success in gene therapy. I think what's most important when you're consenting a patient, again, for either a licensed product or a clinical trial, is making sure the expectation is aligned with what the data that we have. So outlining, what the trial results are. And I think to this point, speaking to sort of a living consent, ensuring that you're incorporating data as it becomes available for that particular vector that you're consenting to. The key point is just making sure that the expectation is aligned and supported by the information that we have in hard data.
Yeah, Jay, can you speak to your expectations as you started the clinical trial and maybe how that evolved?
My expectation on the trial was, gee, if I could even get the factor 9, which is a deficiency I have, if I've got like 1%, which you'll get lots of bleeds, and even some of you don't even know that what caused them. So I was thinking, well, gee, if I get even a few percent above that, from what I understood, it's like, well, then you're just left with, a traumatic impact bleeds that you're going to bleed, so you have the ability to treat them. There was actually a hope. It was an expectation that, well, if I should be able to get that, but it was still kind of a hope, and I was going into it with, I guess you'd say, no firm expectations of anything other than sounds like it might work, so let's go for it. I guess the quick answer is I went into it purposely not having a much expectation other than that I would be, safe. I guess my main expectation was I expect to be safe through all of this.
Yeah, that's a very good expectation. And looking back, is there something now that it's been 6 years, do you have a different perspective?
It was a super enjoyable experience. From the patient point of view, there's nothing more thrilling to see your factor level increasing through the early part of the trial, and then stay at a level that it makes you pretty much a normal normal person. It's hard to explain the joy or whatever you get out of that feeling. Every day I never forget how lucky I am to have been able to be on the trial.
Well, thank you both. I think this has been a really informative discussion. So thank you for your time and input.